All right, thanks, Chris. As we discussed earlier in the show, the Delta variant of COVID-19 is now dominant in California, and kids under the age of 12 are ineligible for the COVID-19 vaccine. So what should parents do now? Back with us now to discuss is Dr. Lauren Crosby from Lapeer Pediatrics, also a spokesperson for the American Academy of Pediatrics. Dr. Crosby, thank you so much for being with us. Parents are a little confused. Tell us whether you think we should actually be worried about this Delta variant.
Well, I think first of all, the big picture is we know what we're dealing with. It's COVID, and it's something we've been dealing with for well over a year. We know how to prevent the spread, and we're better at caring for those who are hospitalized with it. And yes, the Delta variant is highly contagious, but we don't yet know if it is for sure more dangerous. But it is roughly 60% more transmissible than the Alpha variant, which is also known as the UK variant. And this is expected to become the dominant strain in the entire US over the next several weeks. But the good news is, for those eligible for the vaccine is very effective in protecting people who've been vaccinated. And we encourage everyone who is 12 and older, who's eligible to receive that vaccine to get it. Protects them. It protects those who cannot get vaccinated, and also their loved ones who may be vulnerable for other reasons. So it can protect our little ones who can't get vaccinated if everyone else around can.
Yeah, let's go deeper into that, because we can talk about masks, right? LA County is saying, look, the vaccinated people, you're in good stead, you're going to be okay with this Delta variant, yet vaccinated people should wear masks indoors, recommended anyway. And this is to protect those unvaccinated people. So if we bring this into the house, right, you have vaccinated parents in most instances, and then you have kids who are unvaccinated. People wonder, should parents vaccinated be wearing masks around their kids at home?
I don't think so. No, I don't. I think that if those parents are going someplace inside, right, where there's crowds and there's a public, because it's a mix, you don't know who you're around, then of course they should mask. But in general, no, not if they're vaccinated. They shouldn't. It's a good idea for them also to wear masks out and about if their kids need to wear them, though, because then they can serve as good role models for those kids who are too young to be vaccinated.
Right, and this is always a trade-off when we talk about kids, because we're talking about their health versus, on a continuum along with their social and psychological and educational benefits sometimes. So if you think about summer camp season being here, we think about schools coming back, even hangs between kids from other families, what's the recommendation and guidance around masks, indoor, outdoor, etc.?
Well, keep them outside. Basically, if you're not vaccinated, you should be outside. So thank goodness it's summer. So keep the kids outside. Of course, follow your local public health guidelines. But indoors, we should mask. Outdoors, you don't need to mask. But, and in schools, of course, we're going to have guidelines as well. And they're going to have testing and masking and distancing and sanitizing and illness protocols that will help keep the kids safe. We've not seen school be a big spreader place. So I think school will be okay. For play dates, I think it's a good idea. And sometimes it's tricky and you don't have a choice. But a lot of our families are mingling with other vaccinated parent families, at least, so that they know that parents have been vaccinated and believe that that's worth doing. If they've traveled, let's say they've traveled internationally with their kids who are not vaccinated, you might want to delay that play date a couple weeks, especially if they've gone somewhere either internationally or to a low vaccination rate or a high case rate area. So you still have to be careful. Like we were saying, some things are improved and are better, and some things kind of have stayed a little bit the same since before the vaccine.
Yeah, and now when we talk about vaccines and approvals, we need to know about what's going to happen for these kids who are under 12. It's going to be a game changer for families, because we're talking about, most of these adults are vaccinated now in Southern California. But what do we do about the kids? What's the timeline looking like for the approvals for vaccines for kids under 12?
Yeah, I'm getting asked that at work every single day. So Pfizer, Moderna, and Johnson & Johnson are all testing the vaccine in children under 12. Pfizer to apply for that EUA, the emergency use authorization, for ages about 5 to 11 in September, and 2 through 4 probably right after. And then under age 2 years, October, November is what we're hoping for, and the others will probably follow. Vaccines have the power to stop the pandemic, and children do make up a significant part of our population. So vaccinating them must be part of our strategy to control the virus so it can't spread. And also to prevent the emergence of these new variants, we really need to get everyone vaccinated who can get vaccinated.
It remains so important to get everyone vaccinated. That's what's going to prevent any further variants, which then could possibly threaten these vaccines that we've had so far. The vaccines are a game changer. Dr. Crosby, you said it. We continue to say it. Thank you so much for your time today and giving us that information. Really, really appreciate it. We have more coming up.
Thank you.